Okay, so our prototype drug for the COMT inhibitors is a drug called Tasmar or Tolcapone. And I kind of like this because it makes me think of Al Capone, who was tough and took care of his enemies very definitely. And so Tolcapone does the same thing. It kind of strong arms the COMT inhibitors and prevents that enzyme from being able to do what it normally does. So it's kind of an enforcer against the enzyme that breaks down dopamine and sort of protects the dopamine, like Al Capone would do to protect his interests. So that's how I remember it. And it talks about these on the bottom of page 162. So make sure you read these drug tables, the names, how they work, their action, and then all the nursing considerations that go along with it. They're very valuable for studying for the tests. The COMT inhibitors can give you the side effects of dyskinesia, once again, abnormal muscle movements, and it can make blood pressure drop. All these meds do. And you want to avoid other MAO inhibitors, and we'll talk about some with other conditions in chapters 9 and 10. And you just want to not combine these drugs with those MAO inhibitors. MAO is another enzyme that we'll talk about. When it comes to giving Tolcapone or any of the other COMT inhibitors, you want to give with every dose of Sinemet. You give them together, so it kind of helps the Sinemet. It's the bodyguard for the Sinemet. And it helps because then your Sinemet dose can sometimes be decreased. You don't have to take as much, so you're not going to have the side effects from Sinemet. So you give them together. The COMT inhibitors, like a lot of drugs, can cause liver failure. So you want to watch for abdominal pain, abdominal tenderness, jaundice, nausea and vomiting, any signs of liver failure. This can discolor the urine as it's leaving the body, being excreted. That's normal. Some of these meds will discolor body fluids, and it can actually worsen the dyskinesias and the psychosis. So any muscle movement changes and personality changes have to be carefully watched. On page 65, you see patient and family teaching, things you have to tell the patient and family about. So make sure you read those in preparation for the test on chapter 9. The next type of drug that assists dopamine agonists is one of the substances I was just talking about. Monoamide oxidase is another enzyme that breaks down both dopamine and serotonin, MAO-B. And so monoamine oxidase is an enzyme that's found in the brain, and it breaks down these neurotransmitters. When we talk about depression, we're going to be talking about MAO inhibitors that help protect serotonin. This particular MAO-B inhibitor helps protect both serotonin and dopamine. So it's similar to the COMT inhibitor, but it works more with all the neurotransmitters rather than just dopamine. So people who take these drugs, and our prototype is rasagiline or Azilect, and that's discussed on page 165. It can cause dry mouth, other GI problems, and lightheadedness, probably from affecting the blood pressure, again, like all these drugs. There can be a lot of interactions with this. Opiates don't interact very well because opiate drugs can increase dopamine and serotonin. And so something that is adding to dopamine and serotonin in the body can cause problems, including something called serotonin syndrome, which can be life-threatening. Tricyclic antidepressants and amphetamines. All of these increase serotonin. They can be dangerous. And you want to watch substances such as phenylephrine, which is a decongestant, and dextromethorphan. Dextromethorphan is a very common ingredient in most non-opioid cough meds, and it can also cause serotonin changes in the brain. If you take too much dextromethorphan, it's a mild hallucinogenic because of how it affects the neurotransmitters. So this is not something that you want to give in conjunction with this MAO-B inhibitor. It can be dangerous. And you'll find throughout this chapter that dextromethorphan doesn't mix very well with a lot of these medications for mental and emotional conditions that are caused by neurotransmitter action. And a lot of people think that dextromethorphan is very safe because it's sold over the counter, but they have restrictions on it for a reason, because it can cause a lot of problems. For the MAO-B inhibitor, you want to always assess blood pressure and pulse because of the orthostatic hypotension. Sometimes they can go the opposite direction and cause high blood pressure or some other kind of dysrhythmia with a fast heartbeat. Give the drug at the same time every day. Report headaches or heart palpitations or severe nausea and vomiting that doesn't improve. You also want to look for worsening dyskinesias, because too much dopamine can cause increased muscle problems and weird muscle movements. Once again, this is taken with Sinemet, and the hope is that Sinemet can be decreased with this medication. So they're given together again. A lot of foods are restricted on this medication. Some foods contain amino acids or precursors to amino acids. One of these is an amino acid precursor called tyramine. And tyramine and any kind of MAO inhibitor drug can combine and cause that very severe hypertension that I was talking about. People have actually had heart attacks and strokes because their blood pressure just skyrockets, mixing foods and beverages containing tyramine with these MAO inhibitors. So the box on page 166 talks about some of the foods that are restricted. We will talk in chapter 10 about MAO inhibitors for depression, and they also are severely restrictive to the person's diet, so they're difficult to take. 166, read the patient and family teaching for these particular kinds of drugs.